Hello everyone, good morning. Once again back with newer video, and this is directly on World NTD Day. So World Neglected Tropical Disease celebrated on this 30th January. So a brief overview on this, and for this Director General of WHO has given one of the message for everyone, and it's directly has been on the website of WHO. And by the today we will be discussing on NTD diseases which has been enlisted on WHO website by this, and it has been released in this World Neglected Tropical Disease Celebration Day. So the DGWHO has said on World Neglected Tropical Day 2024, WHO is calling on everybody, including leaders, community, to unite and act to address the inequality and to drive this neglected tropical disease, and to make bold, sustainable investment to free the estimated 1.62 billion people in the world most vulnerable communities from this vicious cycle of poverty. So on every year that celebration of World Neglected Tropical Day, so the purpose of this celebration is to raise the profile of neglected tropical diseases, the suffering they cause, to garner support toward their control, followed by elimination, followed by eradication in line that programmatic target set out that entities, and that the same has been proposed in roadmap of 2021 to 2030, as well as the commitment of 2022. So let's go on the next. So basically, once like basically in general overview, that brief guideline, brief overview on NTD has been shared on the WHO. It has expected that was enlisted 20 to 21 disease which is falling in the category of neglected tropical disease. In this, I will provide that link as well. Sorry, the first one is Buruli ulcer. So this is mycobacterial skin infection causing severe destruction of the skin, bone and the soft tissue. Directly it affect on these three. So basically first we can understand that neglected tropical disease are a malfectious group of communicable disease that are common in tropical and subtropical conditions, and yeah, its availability has been shown at the worldwide level in 149 countries. uh, so these is called neglected because they generally affect the world poor and historical, they have not received as much attention. So on this background it is called as neglected. So this Chagas disease, so this is a life-threatening protozoan illness transmitted to human through contact with vector insects, that is bugs, contaminated foods, infected blood transfusion, congenital transmission, organ transplantation, or laboratory accidents. So currently India bears the highest absolute burden of more than 11 major NTDs, except NTDs that require unique insect vector that is specifically available in African countries. So India leads the world in terms of total number of cases for each of the major NTDs, except this one which we have discussed earlier regarding insect vectors. So, being this populous nation of India, India accounts for 18% of these diseases. So, basically, five intervention has been given to overcome these NTD. So, the first one is preventive chemotherapy. This one by coordination and intervention. So this involves the coordinated use of anti-helminthic and antimicrobial medicine alongside complementary public health intervention. It also focuses on treating population at risk by identifying that who are the population at risk and directly treating to them. The second is innovative disease management for NTDs. In this, we can say that key strategy to ensure that universal access to early diagnosis and prompt treatment, as well as improving of surveillance, as well as passive surveillance, accelerating effect toward the elimination, as well as followed by eradication. So this will follow here. The third, vector ecology and management, that is integrated approach. In this integrated approach, we prompting guidelines, developing and promoting our guidelines and their implementation, as well as pesticide in controlling vector association with NTD. Wash, as everyone knows, that wash, water, sanitation and hygiene, and in this this plays a crucial role in management of NTDs. So pathogen causing NTDs, where water and sanitation are inadequate, so the importance of proper sanitation and hygiene, particularly in controlling and soil transmission helminthes. So we have to take care on this for this its promotion. And the last one is veterinary public health services, that is multi-sectoral approach. Likewise in this especially concerning zoonotic diseases transmitted in between vertebrate animals and human. So disease like foodborne diabetes is stresses that need like a multi-sectoral program involving multi-sectoral coordination, communication, partnership. Likewise in this maternal program as well as nutritional program. So Poshan Ma we are celebrating, so that promotes that intersectoral engagement. So this is something like that, the same. Apart from this, dengue and chikungunya is over here, uh, which is more fatal on this, and a higher prevalence. We are getting it in our countries. Two mosquito-borne or outbreak-prone viral conditions causing a flu-like illness, that is, it associated with severe and painful disabling symptoms, and in the case of dengue may cause shock, hemorrhage, as well as death. So it is a significant global health threat. Dengue is as well as primarily it's transmitted by Aedes aegypti mosquito. And dengue virus is causing a spectrum of illness, mild fever to severe hemorrhagic condition. So dengue prevention control focus on eliminating breeding sites, so that in the program that we are running with Gambushi offices in Delhi, that there is a regular awareness, even in the metros, also running metros also, that key not to hold up the water even in their cooler and water like this plant pots. So that all has to be taken care in this. While on the other hand, chikungunya is another arthropod-borne viral infection. Uh, it basically causes joint pain and fever, implicating millions worldwide. So Aedes aegypti and Aedes albopictus is over there. So serve as a vector for chikungunya virus transmission. While chikungunya is generally it is non-fatal rather than dengue. So it is a non-fatal one. So including vector-borne community engagement, we have to provide on chikungunya ability to cause prolonged outbreak demand sustained effort in surveillance research. So these all things has to be take care of this. basically, as per the enlisted all the diseases from the website of WHO in this NTD, we are not able to cover on a single video. So, very like basically in general, that enlisting of disease of NTD has been given. So, just I'm covering that. So the next is Guinea worm disease. It's helminthic infection transmitted exclusively by drinking water. So for the prevention strategies, we can follow that water filtration, safe water sources, as well as water treatment. We can water treatment like we support water treatment method, boiling water for use, as well as followed by chemical disinfection to kill that larva breeding over there. Promoting health education in community awareness, using the PRIs methods, maintenance of personal hygiene. So these we can use in this as a prevention strategies for this particular disease. So echinococcosis, it's larval stage of tapeworm pathogenic cyst in human organ acquired. So for the prevention of this, we have to avoid contact with infected animal, especially dogs in the endemic areas. Practice good hygiene, that wash hand thoroughly, soap and water, that all the parts, and control dog population like is stray dogs. Community awareness we can provide it on this. uh, and apart from this, we can say that key uh, proper disposal of animal waste should be over there, and regular deworming of dog should be done. While dermatodiasis, it is a group of infection disease acquired by consuming fish, vegetables contaminated with larval pesticides. So when infected and contaminated part has been eaten, so that then it result in this foodborne dermatolosis. So by this, as it is getting acquired by consuming fish as well as contaminated vegetables, so we can prevent this by thorough cooking fish. uh, Thoroughly cooking can be prevented. Avoid raw and uncooked foods. So these can help us in the prevention, and as well as the same which is regularly upcoming from the previous first of the disease, like is promoting hygiene practice, community education. as, so these will be the common part in all of these. While leishmaniasis it is a protozoan disease transmitted through a bite of infected female sandflies. So this can be we can as a precaution we can use at our insect repellents. So to procure ourselves, to prevent ourselves from this, from the bites of sandfly, we can use deets and that all the parts which is coming as a part of repellents. Protective clothing can be taken, eliminating breeding sites. Sandflies breed in the dump areas, as well as early diagnosis and treatment. And leprosy is complex disease infects caused by slow growing bacteria over here. So in this, precaution will be that key early diagnosis and treatment, prompt identification, treatment with multi-drug therapy can prevent leprosy. Progress and transmission it can prevent. Contact surveillance, like basically in the contact of let's say if index patient is infected and it is got is on MDT, and so the direct contact person of this index patient can be also given on preventive therapy. So elephantiasis, that is lymphatic filariasis. So it's helminthic disease by mosquito and result in adult form. So this can be prevented by mass drug administration. That camp is like basically on a time to time basis in India. It's regularly its administration is ongoing. Vector control can be done by controlling mosquito vectors such as insecticide treated nets and bed nets using so reduce its transmission. Personal protection can be used, improving sanitation, community education, community awareness. So and the last one which I want to discuss, that is trachoma. So it's a bacterial infection transmitted through direct contact of infectious eyes and nasal discharge and associated with unsafe living condition. So facial hygiene can be maintained to protect ourselves from this by washing our face with soap and water to reduce the transmission. Apart from this, environmental improvement we can provide out. uh, Flies control can be done by like basically eye seeking flies we have to control on this. Proper health education should be given and done. So apart from this, rabies is also a preventable disease by human through bite of infected animal, especially dog. So how it can be prevented? It can be prevented by vaccination. That pets which you are having, that should be on time to time basis. It has to be vaccinated. Avoid We have to avoid stray animals. Prompt wound care. If any dog has been bitten, so immediately clean and disinfect that animal bites, scratches. After that, move on for uh, medical attentions promptly. So one another disease is listed on the website of WHO, that is luma, river blindness, scabies, and this one ectopirosis, bilharzia, snake bite, so mycetoma, and apart from this, soil transmitted helminthiasis. So this is different from that private one, the first one. So helminthiasis, this is directly from soil followed by human feces. So this directly causes anemia and vitamin A deficiency, result in stunting as well as that is malnutrition. On this, Ministry of Women and Child Development, MWCD is working. So proper sanitation, Swachh Bharat Abhiyan is already ongoing. So proper sanitation should be overdone properly, so to prevent that helminthic eggs. Practicing good hygiene, wearing shoes, as well as implementing that deworming program. So this is data from African. This one, yes. So this is also a bacterial disease and mainly affect that skin and bones. So that's it from my side as of now. Let meet us with another newer update that one of the innovative program has been came that AIMS Bhubaneswar has been tasted that they have transferred that blood for transfusion for at one of the CSC from AIMS Bhubaneswar by using the drone. We'll cover in the next video. Thank you. Bye.